Thanks for joining us today, and to Brittany from Redington-Fairview General Hospital for putting this program on. And it is the first in a series of 4 different topics that the Alzheimer's Association, the main chapter, will be sharing with the general public. We are certainly trying to promote the programs to get as many people to attend these very important topics that we're sharing. So certainly if you know of other people, spread the word on the upcoming workshops. But today, I'll introduce myself. I'm Amy Angela. I'm the program manager for the main chapter. And we offer free education throughout the state. And we also have several caregiver support groups, both virtually and in person, available to attend if needed. So today we have Ann Romney, one of our volunteer community educators, who will be presenting the 10 warning signs of Alzheimer's disease. So here's Ann.
Yeah, thank you, Amy and Brittany, and for those that are able to attend this program today. And this is one of our very foundational, I'm going to be sharing a screen here, a presentation screen for you all to see. And this is a really good foundation. I think the order of which these programs are flowing out, it makes a lot of sense. And this is one that really lays out, we look at what the difference is between normal age-related kinds of things that we all experience around our cognitive acuity and things that might be indicators of something, Alzheimer's disease or another form of dementia. So we're going to go through this program. I'm happy to answer. We are a small group, so if you have a question along the way, please just, you can just say, hey, I have a question, because I actually cannot see those of you that are here. So I'm going to be just relying on Amy or Brittany to let me know if there's a question. You can put a question in the chat, or just speak up and I will hear you. So the objectives of this program, we want to talk about typical age-related memory, thinking, or behavior changes. It isn't just memory. It includes behavioral aspects as well in terms of Alzheimer's disease. We want to recognize what those common warning signs of Alzheimer's and dementia are. We want to talk about tips for approaching someone if you have concerns about someone close to you and their memory. We want to talk about how that is sensitive and how you can approach them. We are strong advocates of the importance of early detection and the benefits of a diagnosis early on. We'll talk about what that looks like, what those tests and assessments are for getting a workup and a diagnostic result. And we want always on all of our programs to be clear about what the vast resources are that the Alzheimer's Association has to support people in a number of ways. So we will certainly make sure we address those at the end of our program today. So we're going to look at Alzheimer's through a family, the Garcia family, and they're struggling to understand what is happening with their mom, who is Mary, a 73-year-old widow, and she's living alone. She's a retired teacher. She has always kept a meticulous home. Her daughter, Lydia, has recently been noticing a laundry piling up and junk mail and old newspapers lying around the house. So there's some concern that Mary is exhibiting some different types of behaviors, not typical of Mary. Lydia, here on the left, is the eldest of Mary's 2 daughters, and she's nearby. She just lives a few miles away, and she's the one who's really noticing and seeing some of these changes. And there is another daughter, Patricia, who lives in another state. She works long hours and isn't able to visit her mom as often as she'd like, and she communicates with Mary frequently via phone and text messaging. So often this is representative of what happens in families, often where people are beginning to wonder if something is happening to their parent or loved one. So here's a little text exchange between the 2 sisters. Worried about mom, she's losing things and the house is a mess. Maybe it's normal to get a little forgetful with age, but it's so unlike her. Should we worry? And we're going to reach out to their neighbor,
As
Dr.
we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically, with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
That's a very significant piece, is this idea that these things that are happening are starting to interfere with daily living, as opposed to the frustration that we all might feel when we can't find our phone, but we're usually able to get back and figure out where we had left our phone. So we're going to look at these signs. We're going to hear first from a little foundation here, and we're going to hear a little bit more just in general, what is dementia, what is Alzheimer's disease, and why is it important to know these signs?
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So we often get the question about what is the difference between Alzheimer's and dementia, and really Alzheimer's is just the most common form of this umbrella of syndromes that are considered dementia. So we're going to hear again from another individual about specifically Alzheimer's.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
What's also important, I always want to mention when at this point in the presentation, there are real changes that go on physiologically in the brain. And early on, we don't see, or even throughout really, we don't often notice that there is a physical problem. If someone were to break a leg, we see that this has happened. They're wearing a cast. We understand why they're walking more slowly. But early on, we don't really see any changes in a person. So it makes it harder to really understand that something is going on, when in fact the brain can, in advanced Alzheimer's, diminish by 1/3 of its size. So it really is something that happens on a physical level. So now we'll talk about why it's important, or we'll hear about why it's important to know these signs.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with. Some of the things that can look like Alzheimer's may be other treatable conditions. If it is Alzheimer's, you still want to know as early as possible, because that gives the person and the family time to plan, time to make decisions, and it also gives the person with the disease a voice and allows them to say what they want.
Such an important takeaway there that early on, the individual is still very capable of sharing their needs, their wants, their concerns. So it's so important to include that person to the degree that you can throughout. So now we're going to take a look at these 10 warning signs. And of course, it's a bit of everybody's unique. So some people will have some of these things and others will have others. And it's a matter of piecing together a puzzle early on to try to figure out what's happening. So the first one is memory loss. And that's, of course, what we typically think of when we think of Alzheimer's disease. And it is one of the most common signs. Forgetting recently learned information. A person may have very good recall for things from their past. They may remember their telephone number from when they were 10 years old, but not remember the conversation they had this morning. So some of the other things that happen in terms of memory loss, they can be forgetting important dates or events, that repetition, that asking that same question over and over again because they don't remember that they had already asked that question, and then trying to rely on some aids. That could be notes or other folks to tell them where they need to be when they need to be there, or difficulty doing tasks that they were normally able to do quite easily. Could be something like using a recipe or making something that they've done and all of a sudden becomes confusing. That would be some of the possible signs. For each of these, we'll talk about the signs and then what would be a typical age-related change that we might all experience. So we all forget names occasionally or appointments, but then we remember them and we move on. So that's the first one. The second is challenges in planning or problem solving. We talk about these as executive functioning skills. And some people may experience changes in their ability to develop and follow a plan, work with numbers, which may result in the typical trouble following a familiar recipe, as I mentioned, keeping track of monthly bills, difficulty concentrating, taking much longer to complete tasks. Typically, what might we experience? We all make occasional errors when we're balancing our checkbook or paying our bills. So we'll hear from, the individuals we'll hear from throughout this presentation are not actors. They are actual individuals that are experiencing these changes and going through this disease.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was what I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
I'm very grateful for these folks that are able to share these stories with us. It happens to be so that in, I don't know, roughly 50% of the time, people are not really even aware, or they're in denial. We're not really sure which, but are unable to describe what's going on and what they're experiencing. So the individuals that we have here that are able to describe and explain to us what it's like are invaluable, I think, in terms of our understanding and our ability to be compassionate as well. So the third warning sign is difficulty completing familiar tasks. This can be things like not being able to drive to a place they've always been able to drive to, organizing a shopping list for the grocery store, or even playing a favorite card game or other game where they have always known how to do that and not able to do it. A typical type of thing would be occasionally needing help to use the settings on the microwave or record a TV show, something that we do infrequently that we don't remember how to do. Again, we will hear.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Right. So it's different when you're wondering about something about someone close to you. Is this a change, or is this just something that has always been so? And that's an important distinction for us in trying to understand. Confusion with time or place, that's the fourth one we're looking at here. People can really, who are having Alzheimer's or other dementias, really lose track of dates, the season, the passage of time. They may have trouble understanding something if it has not just happened immediately, and they may forget where or how they got there. So they may think that they're in another state. They may think that it is summer when it's winter. And that can, of course, be very problematic if a person leaves the home dressed not appropriately for the season, etc. Typically, we often say, is this Tuesday or Wednesday? So that's something that we can easily all fall into, but that would not in and of itself be something we would be worried about. The fifth one is trouble understanding visual images and spatial relationships. People don't always recognize that this is an aspect of Alzheimer's or dementia. And this problem can affect balance. It can make it harder to read. It can be something that makes it difficult to drive a car because your ability to judge distance, determining the color of contrast, can really create issues. Driving is one of the earliest things that show up as a concern often in terms of understanding if this is happening. And it is not simply because a person may get lost, but because of these other things that we're talking about in terms of visual imaging and spatial relationships. Of course, all of us can experience eye or vision related changes. And sometimes it's when we're checking out vision that we pick up that somebody has Alzheimer's or another form of dementia. It shows up in the visual.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
So it's always, of course, important not to ignore any kind of change in a person's health and well-being. The next one we'll talk about is having problems with words speaking or writing. So language starts to become a challenge. People might have trouble following or joining a conversation, and this can lead to their withdrawal a bit, and you might start to see some personality changes, but they may stop in the middle of a conversation and really be lost about how to continue. That repetition, again, that can happen frequently. They may struggle with vocabulary. They may have trouble naming a familiar object or using the wrong name. The example I like to give is somebody may look at their watch and say, the time thing isn't working properly. They know that it has something to do with time. They just don't remember right there that it's called a watch. Typically, however, we all have trouble finding that right word occasionally. We're going to hear from Phil.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
Yes. This is something for him, we would recognize that this is a very different thing for Phil. The seventh one, I didn't skip one, did I? No, good. We're on the seventh one, which is misplacing things and losing the ability to retrace steps. So we all may put our phone down when we walk in the door, or put our keys down and then go looking for it and realize, oh wait, I came in, I took my coat off, so maybe I put it down over there. We have that ability to retrace our steps. But a person living with Alzheimer's may put things in unusual places, may be unable to go back over the steps to find them. And that can sometimes lead to accusations that others have taken something because they don't believe that they themselves have misplaced something. But typically, of course, we all do forget where we put things from time to time.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space, so there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
And we will now look at and talk about decreased or poor judgment. And this is really an important thing that can really have a serious impact when people make some bad decisions. They may experience poor judgment when dealing with money, and that's where we know that people can be very vulnerable to some of the scam kinds of things that are out there, or just overspending and purchasing something that they would not have done otherwise. Paying less attention, you may notice things, grooming changes, things that a person has always been meticulous perhaps about themselves, and then all of a sudden they're not appearing in that way. Of course, we all make bad decisions occasionally, and we may forget to do certain things like changing the oil in our car. So that would not represent a warning sign, but we will hear for Teresa what she was recognizing about herself.
The way I kept my house, and all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
So for her, she had always been very meticulous, and so she was aware of this change. Now, oftentimes we see personality changes in a sense, or a person becoming more withdrawn from some of the things they've been involved with, so from social activities. A person may stop being interested in doing some of their hobbies or other engagements, or they're having trouble keeping up with a favorite team or activity, losing interest in those sorts of things. My father had Alzheimer's disease and was a huge baseball fan. And I tried to get him to pay attention to baseball as he was advancing in his disease, and he really had lost all interest. So we knew that this was a significant change for him. Typically, we all have our moods, and we may be not interested in something on a particular day, but this is a more chronic kind of change in interest or motivation.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. Can be one of the early signs of Alzheimer's.
Which makes so much sense that a person would withdraw if they were experiencing that kind of cognitive slowing down, if you will. So this is very connected to that last one, which is changes in mood and personality that you may notice. That could be one of the early signs. A person becoming confused, they may feel suspicious or depressed, fearful or anxious. These are typical kinds of responses. They might get more upset easily with friends or whenever they're out of their comfort zone. Typically, we all have our ways and our habits of doing things, and we might become irritable when our routine is disrupted, but we're talking again about a more chronic type of pattern.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So that's where we've now laid out what these different signs are. And again, it's unlikely that somebody would have all of these things, but these are what the things are to tune into when you're trying to understand if there is something going on. And if you do notice these kinds of signs to any degree in a person close to you or yourself, it is important, again, that early diagnosis and to find out what's going on for so many reasons. That's true. So we're going to talk now about how you interpret those signs and deciding what you might do next. So we're back to the Garcia family, and the sisters are texting back and forth. Did you look at the warning sign information I sent? I did, but I still don't know. Mom's showing a couple signs, but not all the time. How do we know if it's serious enough to see a doctor? So we're going to hear what Dr. Salloway has to say about that.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
Right, and in that early stage, people are trying to weigh, is this happening a lot? Is that one happening a lot? And also there's a fair amount of denial often and fear for the people close to that person to see if that is really what is happening. So we have to kind of challenge ourselves to look directly at what might be happening. So just to recap this portion of the presentation where we're identifying the 10 signs, these are a guide to identifying problems that may be related to Alzheimer's. Individuals may experience one or multiple warning signs in varying degrees, but they do not have to experience them all for there to be concern. And if you notice any of these signs in yourself or someone else, it is important to see a doctor. So now we're going to shift a little more and talk about that early detection and what that looks like, why it's important. We're going to hear again.
It's a very interesting phenomenon that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, in more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Right, there's that concern again. and we'll see what Mary noticed.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So these are the kinds of things that people begin to observe in people close to them. So we have a 10-step approach to present in terms of how you would go about assessing a situation that you're concerned about. So we're going to look at each of those steps. First step would be, what are those changes in memory and thinking or behavior that you're seeing, and taking notes. It is important to really jot things down so that you, when you do ultimately get to a medical professional, you have a good record of what those kinds of things are. So observe what those are, talk to other people, to other family members or close people, to see if they also are observing some of these things. You also might want to look at what else might be going on that could be a factor in some of the things that you're observing. So there may be other medical kinds of things or stresses in a person's life that may be contributing to the things that you're noticing. So you want to become aware of what else might be going on. Do what you're doing today, which is learning about the signs and the benefits of early diagnosis. That's an important piece of all of this. And as I had already alluded to, it's good to check in with other people. Is this just something you're noticing, or have other people noticed these things as well? People that are close to you and that you can trust for honest feedback. This next one, having a conversation, this is a very big piece of all of this. We actually have a program called Dementia Conversations, which delves deeply into how to approach this very sensitive subject. It's not an easy subject to bring up with someone. It requires a lot of sensitivity and planning and preparation. The kinds of things you would want to consider is who should have the conversation to discuss these concerns. Is it you? Are there other medical people? Is it their primary care physician, a trusted friend? So this is something you would take into consideration. You would want to think about the best time and place to have the conversation, certainly not when somebody is stressed or when you don't have a lot of time. And I would say, I would add plurals to this, the conversations. I don't think this is a one type of conversation, a one-time event. I think it's something that you broach and then revisit and keep talking about as things evolve. It's very helpful to offer to go with the person to the doctor if this is somebody very close to you, a spouse, a sibling, a parent. Important for knowledge sake and also support to go with that person. As I had said, have multiple conversations. I know of no one where there was one conversation about this. This is something that progresses typically on rather slowly, and there's plenty of time to have many conversations. And reaching out for support, very, very important. We're going to go over how much support is available through the Alzheimer's Association, but you may have other friends, family that can step up and be of support to people. This is not something you can go through alone. It really does require support and help from others. Really an important piece, really important to take away that from this program. So in terms of the Alzheimer's Association, lots of support and information there. We will go over exactly all of those components at the end of the program. But in terms of seeing a doctor, that would, of course, be a very early stage that you would do. Most people address the concerns around memory, thinking, behavior with their primary care physician first. And many primary care physicians are very well informed. They can do some initial assessment, but in some cases, the primary care physician will refer the person to see a specialist for further evaluation. What those specialists may include: geriatricians, neurologists, neuropsychologists, a psychiatrist, or a psychologist. So you might see one or more of these types of specialists in terms of getting that workup and figuring out what might be going on. And we really do emphasize the benefits of that early detection, which is what you're doing when you're seeking this medical advice or workup. And we will hear from.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So lots of reasons. And we also know that there are other things that cause cognitive decline and memory issues that may be reversible, may not be Alzheimer's or another form of dementia. Could be a medication that's off, a thyroid that's not operating properly. There are a number of reasons. Even just infections can sometimes cause cognitive decline. So really important to get that early work. So just to recap on this, early detection, paying attention to changes in memory, thinking, or behavior that you notice. That's the first thing, is to really be aware of what you're observing. If you see changes that are unusual for that person, you want to begin having a conversation with them about this. Discussing these types of concerns can be difficult, so we do have that 10-step approach to memory concerns. There are a number of benefits to early detection, which include planning for the future, exploring the treatment options that are out there, and participating in clinical studies. If you do decide to seek a diagnosis, this is what it might begin to look like. We'll start with a little test here, test your knowledge. Is it true or false that there's currently no way to diagnose Alzheimer's disease? And that actually is false. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's disease with a high degree of certainty. This wasn't always true, but we have advanced where that is now true. And here are some of the kinds of things that you might have as part of your assessment: a full medical history, a physical exam. There may be a screening for depression, an interview with a close companion, and some of the tests may be lab tests, mental cognitive status tests. There may be brain imaging or cerebral spinal fluid analysis. So those are some of the components of what might be in a workup. Here's another question: do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? And we have already talked about the fact that that is not always the case. So here's the sisters are back texting again. Appointments have been going well. Mom's handling them okay. Do we think it's really dementia? I guess we won't know until we get a full diagnosis, but let's ask Dr. Salloway if it could be something else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
Very important piece to take away from this program. So just to recap around this diagnosis process, will be different for every person, what gets done and what gets worked up. Something other than Alzheimer's or another form of dementia could be causing the symptoms you're observing. And the stigma and misconceptions about the disease, like believing that nothing can be done, can prevent some people from seeking a diagnosis. We're trying very hard to not have that be the case and to not have that stigma. So then if there is a diagnosis of Alzheimer's disease, what's next? What can you expect? The sisters are going back and forth about it again. I called but got your voicemail. How did it go? I'll call you later when I get home, but the diagnosis is early stage Alzheimer's. So Alzheimer's is a progressive disease with an early, middle, and late stage. Oh no, what do we do now? The doc says the Alzheimer's Association offers free resources. Some even help people live well with the disease. We'll call soon, but left the office with some hope. And there is a lot of reason to have that kind of hope. There's a lot of quality of life that continues well beyond that early diagnosis. So we're going to just review here a bit about what the Alzheimer's has to offer. We are nationwide. I'm going to advance past that slide. But we have we'll start with our helpline, which is a 24/7 number. And this is something that we have trained social workers on the other end, professionals. These are not telephone operators. And we're going to hear from Tim, who has had a very positive experience with the helpline.
I've had a couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Very important. And we also have our website, alz.org, which has so much information and resources for
When
folks.
I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has it been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found the support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
Yeah, really, it just keeps getting better and better, the resources that are on our website. In the number of years that I've been involved here, I've seen a lot of improvement along the way.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time, or if I'm struggling to find some resource, that they will provide that to me.
So very important that people are aware and let other people know as well that there are tremendous resources available. We don't think people should go through this alone, as I have said, and I can always continue to reinforce that message. And then, of course, we have ways of getting involved and connected with the Alzheimer's Association and what some of those are. There are lots of different ways to volunteer. You can become an advocate in terms of reaching out to the government, both state and federal, to make sure that there's funding and support for research and also for care support. We have something called Trial Match, which helps people connect with some of the clinical trials that are happening. We have the Walk to End Alzheimer's and the Longest Day, which we'll just take a peek at these individually. There are lots of different ways in which people can get involved in volunteering, and you can become a community educator like I am doing right here, right now. You can be part of the walk. There are lots of different ways in terms of volunteering. As an advocate, you can speak out on behalf of the needs and rights of those facing Alzheimer's disease. And we have a place where you can go, allsimpact.org. Trial Match, as I mentioned, matches folks with different, not just pharmaceutical trials, actually. There are some lifestyle trials as well that look at nutrition and exercise and social engagement. So there are lots of different ways in which you can be part of a trial. And that helps the individual as well as all of us learn more. And in terms of the research, there is the Walk to End Alzheimer's, which is our largest fundraising event, which is held annually in more than 600 communities. It happens in the fall, and it raises awareness, and people register in groups often, and that's got a lot of presence, and it's a very successful fundraiser. And then we also have the Longest Day, which is kind of a do-it-yourself fundraiser. It happens on the summer solstice, and you can do hiking or baking or knitting or any kind of activity that you get people to sponsor you, and they're again spreading awareness and raising funds. So that's a kind of fun do-it-yourself type of fundraising event. And I am going to stop sharing and see if there's a question or a comment that you might have. So I know, David, that you're there, and as with your, I'm guessing your wife is there as well with you. And if either of you have a question, I'm very happy to hear what it is, or just a comment as well.
Yes, you can always put it in the chat as well if you don't feel comfortable coming off of mute. I know sometimes that folks don't like that, so please feel free to put it in the chat, or there is a Q&A box. I just wanted to say thank you, Anne, for taking the time to come present this. It was very informative. I learned a lot, and I'm hopeful that when we do post this online from recording, that it will reach more people. Just going to put a plug in here for our next class. If we are going to get questions in the chat box, we do have another class coming up. As Amy mentioned, this is part of a series, March 27th from 5 to 6. In the evening time. It is also on Zoom. We are going to be talking about understanding Alzheimer's and dementia. So kind of taking it a step further from what Anne talked about the warning signs and how to start that conversation. So if anyone is interested, you are more than welcome to reach out to me to sign up. And that one will also be recorded and put on our YouTube page. I'm not seeing any questions in the chat, but I will put, I do have a survey that I'm going to ask those who did attend to just consider filling out. It just helps our presenter know how the class went for you as a participant. It helps me know in terms of scheduling future classes and knowing what our participants are looking for. So if you would kindly fill that out. And just again, thank you so much, Anne, for being here, and thank you, Amy, for helping make this happen.
My pleasure. Thanks for having us, and good luck to all. We'll see you again, I think. Great.
Thanks, Anne.